Everybody in Canada has heard stories or knows somebody who has been impacted by the problems in our health system. Whether you can't get a doctor, whether you can't have an operation. This week, some stats came out about people dying who couldn't get operations. Michael Diamond is a political strategist. He's also a very smart guy. He joins me right now. He knows about government and public policy. Clearly, we need changes to the health system. It's not just money. And yet, every time someone talks about a change or prospective change, universality. And the commies, the NDP, will say, oh, we can't have that because it's universality. Where is this going to end up?
Well, you know what? I mean, you're so right. You know, we have Canadians who are willing to die, literally people who are willing to die in defense of this ideological belief that that the Canada Health Act is the crown jewel of our confederation.
Well, it was 70 years ago.
And it's not anymore, and people
Right.
are dying. I know people who've died because of that belief. We also right now do have alternatives. If you're rich enough, and in good enough health, you can travel to the United States. If you happen to live in the right neighborhood and your neighbor's the head of surgery, you can usually cut the line in some cases. So we already have different streams of folks. So it's the unconnected, the unwell, and the unwealthy who pay the brunt of the price for our broken system.
But that's the majority of the people right now.
That's absolutely the majority of the people. And
when people can't get doctors, when people can't get operations, what are we going to do to change the system?
We absolutely need to change the system. And, if we're going to hold universality up as the main goal, and I believe that is a worthy goal.
It's laudable.
We cannot be, being more Americanized is not the solution. Look to the rest of the world, though. Look at the United Kingdom, look at Sweden, where there are multiple delivery models. And if the important thing is that everyone should be able to access the healthcare they need in a timely manner without being reliant on their ability to pay, we can still do that with private delivery. But that is a bad word in this country, even though I will still be able to go into a clinic, I will still be able to go get service, not have to present my credit card, present my Ontario health card.
But multiple delivery models, what is that?
Well, that would mean, it would vary country to country. In some countries, you have doctors really bidding on what their fees should be, and then I think it's a Dutch auction where you go with the low one. The low one sets the price. For example, that's a way to do more.
Or is it the ability to have it from insurance?
Well, you can. That's an option in other countries. Even looking at partnering with private enterprise, like we already do in Canada. The very successful vaccine rollout was made possible by privately owned pharmacies. I went to get my COVID vaccine at a Shoppers. I did not have to present my credit card, but it was delivered to me in a private healthcare facility. That is not a bad thing.
So what you're saying is that there are valid options. They will not, and you're saying those options do not detract from universality.
They don't have to.
So let's have a good public debate without people saying the sky's falling.
Absolutely. And if you look at some of the conversations here in Ontario, we had people just say, no, no, no to any change. We need change.
Let's get smarter. Thanks very much, Michael Diamond. He's smart. If you did not know that the red ensign, formerly Canada's flag, has now been labeled by the Canadian government a symbol of hate, and they're sending that to all the students, then press subscribe and PayPal and learn more.